It's 9 years ago since I got breast cancer, and it was a breast care nurse at Forester Hill. She said that I might be interested in going down this route, and so I never heard of Mistletoe therapy before that, so I decided to come along, and it was the best thing I ever did.
I'm alive. That's a very positive effect.
I don't know, but that possibly was the first major thing. I mean, I don't know that it was the mistletoe. The hospital were very surprised. They were amazed that there was no trace of cancer in those 21 lymph nodes.
According to my consultant, the cancer is gone.
Right.
Well, we have long discussion with my consultant. He says we cannot call it a miracle because you were on mistletoe, so you were being treated. But he recognized that there is no explanation for the cancer to leave me.
When he examined me on that last day, he could feel no lesions. Now, after my intensive care, I had a scan, and there were many lesions on my liver and spleen that they could do nothing about except to wait until I was well enough to have more chemo. I've never had more chemo. It's just been amazing. And the lesions were there, and then eventually they weren't there.
I just felt it made me feel better. But at the same time, the things that I had been told, it kills cancer cells, it shrinks tumours, it boosts the immune system, so why not give it a try?
As far as I know, mistletoe is useful. Mistletoe is beneficial for all types of cancers. In fact, I think Morris said that in his talk. But when I first went to Park Atwood and had the mistletoe for the breast cancer, I think he started me off on ash, because the mistletoe that grows on the ash tree, because he explained that the constituents of the mistletoe in the form in which they occur on that host tree are particularly beneficial for breast cancer. Recently I was in Stroud in Gloucestershire, and a friend took me up a hill near her house, and I was overjoyed to see that some of the trees there had clumps of mistletoe growing on them, but I didn't see any of these really large spherical clumps like you see in the photographs. In some cases it was just a small little twig of mistletoe growing straight out of the branch. But it's not a parasite, you see, and it grows, and in fact some of the trees that it grows on are healthier than they would be if mistletoe didn't grow there, so it's not sucking the life forces out of the tree.
I got it in 3 different ways. I got it subcutaneous in my tummy, I got it as an IV drip, and I got it into the tumors. Into the tumors were the ones which created the fever, but the other ones were always right around it.
They start the mistletoe at quite a low level because there's different strengths. So I would have been on the lower strengths, because if you build it up slowly, it's, the doctor can assess how you tolerate different strengths. Not everybody can tolerate the same strengths. Or different trees. I'm on ash and apple.
When you're well looked after, and you're you're safe. There's a nurse there. You're looked after. I didn't have one worry about that. Only this fever to cope with. In a bed with a nice duvet around you and hot water bottles and herb teas. And it's not so bad. I didn't mind that so much. And then you had the feeling I was doing the thing I wanted to do most, which was hoping to get rid of this cancer without chemo.
It's a really positive sense of all I need to be doing at this moment in my life is having this fever. That is my task at this moment. And it's like a wonderful feeling of liberation, because for once in your life you know you're doing what you're supposed to. You're totally in harmony with what life is asking of you at that moment.
There is this tumor, is something not right. We don't quite know really what, physically with the cells what cancer is, but we don't really know why people get cancer, why the one does and the other one doesn't. We don't really know what it is. And the body, for me what it felt like, that the body had stored something up which created that cancer, and that by heating it up, cooking it, something was able to dissolve, something was able to sort itself physically, but I felt it in my whole being, or something got organized, got sorted, got rid of. It was quite a specific experience in my life which had been very, very hard. And the relationship to it changed because of in that fever. I knew exactly what was happening, and I can also remember it exactly. Something shifted. Nothing physically changed straight away with the tumor, but in me something had changed, what I trusted, which had straight to do with the mistletoe. And out of that, I trusted the mistletoe.
It's just, I don't know, it's a really comforting feeling, just the whole experience. I mean, because it's given in a small cosy room and you're on a couch, you've got a duvet. Normally what happens is that I just cozy myself down and sleep for the duration of the treatment. But I just find the whole experience really relaxing, and it really does give you a warm feeling. And you just feel so much better afterwards.
No, just an itchy bit. That was about it, just for the day after it was after I injected myself. No problems at all.
Not really. I was warned before I had my first treatment that I could have side effects, flu-y, shivery feeling, and I was told that some people say it's worse than a really bad flu. But to be honest, I seem to tolerate the doses quite well. I do get shivery. It is an uncontrollable shivering, and it really does feel like you've got a bad flu coming on, lots of aches and things. But usually I just go to bed with a hot water bottle for a couple of hours and it passes, and after that I'm fine. And it seems to bring on an appetite. So, and it's almost like flicking a switch, the energy levels. My partner said it's, sometimes by the time I've come from therapy, it's been a few weeks and I'm really tired and lethargic, and he said it's almost like flicking a switch on the car on the way home, that the energy levels go up straight away. So no, really the side effects haven't put me off at all. It's certainly not as bad as chemotherapy. So.
No, I haven't had chemo. As I like to say, I didn't take up the invitation to have chemo and radiotherapy. And Maurice Orange at Park Atwood, he did at one point say to me, don't rule out chemotherapy. And so I understand that my situation was that there was no guarantee ever that the mistletoe on its own would be enough. The surgeon certainly recommended operation, chemotherapy, radiotherapy, and then probably one of the hormone treatments, except that I wasn't receptive to those hormone treatments. So, I think I've been very fortunate.
So afraid of chemo. I would do anything to try to avoid chemo. That was my starting point.
Because I was able to be on the mistletoe right from the start, even before the surgery, and that you do have this sense of well-being, and you have this sense of being taken care of in a bigger way than just the surroundings. And the way I used to put it to myself is that I felt I was guided and protected every step of the way.
You're diagnosed, and then you get the prescription. You have a chemo. I would have been given in the normal hospital. There was a chemo and possibly a radiation afterwards. It was a set treatment with a beginning and an end. And if it would gone well, which was a big chance that it would have worked, this would have been it. And we would have known from the beginning this is what we were hoping to get. With the mistletoe, it never worked like that. We did a little bit on the way, and then we had to see how I was doing with it, and in that situation decide together with the doctor, like a team really, what is the next step, and then a little bit next on, and you do a few more steps and you would see how I was. So
when I was going through chemotherapy, I was really sick. For about a couple of days I could hardly raise my head off the pillow. I was so sick. And as soon as I was able to inject myself, I just felt like my spirits had lifted. It was an amazing feeling. But and each time it was exactly the same. But it took 2 or 3 days, because I had to wait about 2 or 3 days to do this. And as soon as I did it, I just felt absolutely different.
And I believe that I've not had any side effects from the chemotherapy or the radiotherapy, because I've been on the mistletoe before I went on the treatments. So that's, my immune system was strong anyway. And now getting this is what I believe anyway, or what I've read about the Palmade medicine. I think it does it. I think it helps you beat off infections or stops you getting them. Most of the people I saw in the chemotherapy units and all the places I were very depressed, very low in spirit, very ill looking, with all the side effects they were having from pills, water retention here and this and that, and dry skin, obviously with all the chemo. I went through it, and the only thing I lost, I was quite hairy, was my hairy chest kind of thing. My wife likes it. But no hair, no. And it just stopped in July there, my chemo. And like I say, I just got back a couple of weeks ago, and I just finished my radiotherapy on Friday there.
The mood swings, I felt beforehand, I suppose, desperate. I didn't know what was happening. I just felt totally at, I suppose, my lowest ebb. But when I started taking the mistletoe, I just felt better. I just felt it gave me hope, gave me confidence.
It was actually one of my district nurses who suggested it. She came to have a chat when I was first told that basically it was terminal, and we had a good long chat about it, and she asked if I'd thought about mistletoe therapy, and I said that I had heard of it, but I thought it was just for breast cancer, and she said no, that they did have other patients who were getting it for various types of cancer. So she said that I should go to Clan in the first instance to find out about it. So I got an appointment the following day there and saw Dr. McCaffrey there. She started me on the 0.2 milligram injection straight away, but suggested that I get my GP to refer me to Dr. Guider. So although my GP does admit that he's much more comfortable with conventional treatments, he said that at my stage he wasn't going to play God and say that I couldn't have some things. So he was quite happy to refer me. So that was the route that I came through.
Oh yeah, the fact that the disease left me, that completely changed my mind, because I was practically doing nothing anymore. I was going vegetable, and then slowly everything disappeared and I came back to normal.
I feel much more positive in myself, whereas I guess before, when I first got the diagnosis, I was kind of wondering how long I had left to go, and that thought really doesn't cross my mind anymore. I kind of had got to the stage where I wasn't buying things and I wasn't planning things too far in advance because I didn't know how I would be. I didn't know, where I would be. So I don't think about it at all now. We're making plans way in advance now. So to be quite honest, I just don't think of myself having cancer anymore. I just feel really quite well at the moment, so it doesn't dominate my life anymore.
Well, actually, I think my story is a bit different from most people's, that I haven't been diagnosed with cancer, but my system was generally very run down last year, so I was prescribed mistletoe injections as a general boost. I suppose there was a danger that my immune system was really getting very low, and I definitely benefited. I began, gradually to have a greater sense of well-being.
Initially, when I first took the mistletoe, you get this rather big reaction, which they say is good because it means that your immune system's reacting to what they're giving you. The problem I have, if they didn't intervene, it could possibly have become cancerous. But at the same time, my own immune system wasn't dealing with what it should have been on its own, So I think the help of the mistletoe has made my immune system respond a bit more and hopefully save me having to have more surgeries.
And I think sometimes when people are coping with difficult situations in their lives, that affects the strength of their immune system and makes them more or less prone to developing certain disease processes at particular times in their life. And I think these are learning experiences, ones we don't always wish for, but I think there's always something positive to be gained eventually.
Well, they see a big change in me for getting the mistletoe. If I hadn't got the mistletoe, it would mean the cancer wouldn't been all round me.
The consultants in haematology said, yes, take your mistletoe, but it will do you no harm, was the attitude, and my GP the same.
And it's been my experience in our area that they certainly have experience of people being treated with mistletoe, and the experience seems to be good. They keep quoting one lady who's survived 5 years longer than was thought, so their experience of it seems to be quite good, so they're quite willing to pass on the information.
Some people who haven't personally had experience still are quite interested. Other people have absolutely closed minds and they don't want to listen, they don't want to know. I think generally amongst people I know there's a greater curiosity.
Everybody was surprised and interested, but nobody had negative comments.
Well, my family said if it's going to help you, just go ahead and get it done. And they supported me very, very much. So, and they said it's marvellous how you can walk and everything like that. But where you couldn't do that before.
Just take charge as far as you can. Well, take charge from your perspective of the illness. You can't be expert in everything, but you're expert in yourself.
And the doctors can't do it for you. You have to have the power to do it.
Give it a try, because I think you'll find that you do benefit from it. Perhaps not always in the obvious way that perhaps you had hoped for, but gradually over time you realise that you are benefiting, you know. Maybe the results aren't as quick as you would wish them to be, but they are coming in the time that they need to take to come.
So unfair. You know, you got a chance, you have it, you don't, and I haven't. It's just, you know, you could get so angry out of that way. And I know that the mistletoe experience, these fever experiences I had, was the opposite. On the level of experience, there was nothing by chance that I had this cancer. I couldn't have had this fever with the inner experiences of reorganizing things just by chance, which gave me the feeling there was meaning to the illness and meaning to the getting better, and that is somehow, I think, where the mistletoe is the most, has been the most helpful for me.
And it's certainly improved my quality of life hugely. I used to have, because where my tumour is, it was pressing on the sciatic nerve, I used to have quite a lot of numbness in my leg, which gave me quite a lot of pain. That numbness is gone now. I can go longer between taking painkillers, so that kind of indicates to me that it is definitely doing some good. So I would certainly encourage anybody to give it a go, and not to give up hope, because that's, if nothing else, that's the one thing it gives you. It gives you hope, and it really empowers you, makes you feel like you're taking things into your own control again, rather than just being told by doctors and oncologists what you have to do. And just a general feeling of well-being is worthwhile.
Like all my questions. I was just trying to think of anything else.